My name is Judy. I will be doing your 3 injections. With your 3 injections, I've got to have a helper to show me the sites. And I'm going to use my husband as my helper. And with your intradermal injection, you will use the forearm as one of the injections. And there's a spot on the back. It's underneath your shoulder blade, which is scapula area, to give an injection. And with these injections, it's usually you're given a TB test or an allergy shot. Okay, and then you have your subcutaneous. With your subcutaneous, we give it in the fatty part of the arm, right here. Or there's a spot on your back, underneath the shoulder blade to give it to you. Or your ventrogluteal area, which is your upper buttocks. And what people call the love handles is what you give it on. And then you turn you around. Then you have your anterior part of your thigh, which is like you take a line down the middle of your thigh front, and then on the side, and in between there is where you will be given shot or injection. And then in your abdomen area, you go 2 fingers out from your belly button, and there's where you'll be given your injections at. And for your intramuscular, you have your deltoid muscle up here. I've got to do it with this hand to show you, so I ain't in the screen. With the deltoid muscle, you go 3 fingers down. You can tell by doing this to find that gap. Go 3 fingers down from your chromium process. Make like an imaginary V on your arm, and then with the imaginary V in the middle part, which would be the thickest part of your muscle, is where you would be given your injections at. And then you have your vastus lateralis. With your vastus lateralis of your thigh, your upper thigh, you go down the middle, and then on the side, you divide your thigh in the middle and on the side within 3/3 or in thirds, and then horizontal and vertical, and in the middle third is where you would give your injection. And then for your ventrogluteal, you have your hip. Go with your greater cantril, put your palm on it, and then take your pointy finger out to your iliac spine, and your middle finger up towards your iliac crest, and in between there is where you'd be given your shot. Thank you, baby.
You're welcome.
And with your injections is like the needle sizes and gauges and everything. With the intradermal is like 2.5 or 0.25 to 0.05 inches. Use like a 25 to 27 inch gauge, and you do it like in a 5 to 15 degree angle when you're given that shot or injection. With the subcutaneous, you use like a 3/8 needle up to a 1 inch needle. Usually you use like maybe 3/8 to 5/8 inch needle. And it's usually given like a 25 to 30 gauge needle and a 45 to 90 degree angle. And with the intramuscular, you give like, it's 5/8 to 1 inch, and it's the 20 to 25 inch needle and a 90 degree angle. Okay, now I got the needle sizes and all that out of the way. I'm doing my 3 medication checks, my 11 rights, my GPSP is being done, and I'll ask my patient for allergies. Excuse me. And with when you're given injections, see, the shorter needle is for like skinnier people. The longer needles for like bigger people. It's based on like and it's also based on medications, uh, injection sites, and the patient. Yeah. And when you're doing the injections, you're doing it with I'm right-handed, so it would be my dominant hand would be holding the needle. My non-dominant hand would be the one like pulling the cap off and all that stuff. And the areas that you want to avoid the areas of broken skin, open skin, highly pigmented areas, lesions, bruises, hairy parts of the body. That's what you want to avoid. Okay, so what I am going to do right now, I am going to prepare the medication for the injection. I'm going to try to get all this done in one video. And with the medications, I'm going to go and I did my rights, my med checks and everything. So I'm going to go ahead and prepare my medications. And the first one I'm going to prepare it with, since I done give you all the needle sizes and everything, first one I'm going to prepare it with is going to be for the TB test, because I'm going to do them all three at one time. With the TB test, I'm using a 26 gauge needle with a 26 gauge needle with it's 3/8 inch long. I'll spit it out there eventually. And then with that, and then I'm going to, with the insulin, it's going to be a 29 gauge that's 1/2 inch long. And with the, let's say I'm going to give a flu injection. A flu injection would be a 22 gauge needle, 1.5 inch long. Okay, so what I'm going to do is I'm going to do my hand hygiene, which if I was in a facility, I would be washing my hands to do all this. So I'm going to do my hand hygiene. I'm going to put me a pair of gloves on. Well, if I can. Okay, and then what I'm going to do, move my gloves here out of the way for a second. Just get a few of them out. Put them there. Okay, now I am going to take my insulin needle, or my TB test needle, sorry. I'll take my TB test needle, and I'm going to take my dominant hand to hold the needle, and then my non-dominant hand to pull the cap off. But before I do that, I need to alcohol my TB test, my TB injection, whatever. So I'm going to open my alcohol. I'm going to alcohol the top of the bottle. And dispose of my alcohol. And then I'm going to take my dominant hand, hold the needle, my non-dominant hand, pull the cap off. Okay. And then I'm going to inject it into my vial, hold my vial steady, inject it into the vial. First, I'm going to fill it with air because it is a multi-use bottle. So I have to fill it with air up to 0.1. It'll be my injection for the TB. So I'm going to fill it with 0.1. Stabilize. Put my needle in. Push it down, only touching the tip of the plunger. Push the air in. Pour the vial up. Then I'm going to stabilize the vial with my fingers and my thumb. And then I'm going to, I gotta be able to see the light. pull the medication back, only touching the tip, and stabilize it with my other finger to 1 ml. And then I'm going to turn the bottle back down, which I'm going to push it down and pretend that I am got my injection ready. Pull it back up to 1. And then recap the needle. When I recap the needle, I'm going to recap the needle by scooping in and putting it back on there. And that one is ready for injection. And then I'm going to do the insulin the same way. The insulin, I'm going to take my non-dominant hand. I'll get my insulin bottle ready. With my insulin bottle, I'm using the 29 gauge, 1/2 inch long for the insulin. And with my insulin, it's going to be Lantus. Ten units. Because I already did a glucose check on my patient. So the glucose was 300. So I needed to, the order called for 10 units of insulin, Lantus. So I'm going to take my dominant hand, hold the needle, pull the cap off with the dominant hand. And then I'm going to pull back 10 units. Inject air into the bottle because it'll be a multi-use bottle for insulin. Take it and turn it up. Stabilizing. Pushing the air in. Only touching the tip. Pulling the medication out of the bottle to 10 units. And then turning it back up, by which I am going to put the medication back in and pretend that I am got the 10 units that I need. Did the scooping motion. Scoop my needle back in the cap. And then I have that ready for my other injection. And then with my flu injection, my flu is Flozone. Flozone will be given 0.5 milliliters. I am using a 22 gauge needle, 1.5 inches long. Okay, I'm going to remove the cap. I'm going to pull back the needle to, I think it's 0.5. I just have to pretend it's the right needle. 0.5, because I couldn't find one. I looked. And then inject it in. And turn it up. I have to restart this because it's not working right. Okay. Have to do, push it in. Pull the air up. 0.5. 0.5. Put it in. Turn the bottle up, only touching the tip of the syringe, holding it with my hand, non-dominant hand. So I am pulling out Fluzone. Pretend I'm pulling it, pushing air in. Pretending I'm pulling the Fluzone out, only touching the tip. I have to stabilize it by the outer end piece. Only touching the tip, which I'm going to put this back in and pretend that I have done this. Have it ready. 0.5 mLs. Do the scoop method. Scoop it back in. And I have this injection ready. So I will have done my 3 medication checks. Check these medications with a second nurse to make sure everything matches with the patient, with the medication and everything. And I've done my 3 medication checks, my 11 rights, and I'm doing my GPSP. I will have got everything ready. Come out and do my hand hygiene again. I will gather my stuff up. I'll take it to the room. And then I will, I go into the room, announce myself. Hi, I'm Judy. I have your 3 injections today. Before you go home this evening, I have your insulin, your flu vaccine, and your TB test. I tell them just like that. I will be checking, for the adverse reactions and everything on it. I'm going to get my skin texture ready. And my needles. Get all that stuff ready. Now, with the intradermal, I got to talk a minute before I do the injections. With the intradermal, it's a TB test. And with the TB test, the TB has the longest absorption time in it. And I'll be checking the ID band and checking the patients give their name, date of birth, and I done said I did the 3-minute medication checks and all that, and making sure that everything is based on the facility's policy. And with the facility's policy, I'll explain the purpose of each medication that I give the patient before they leave and go home today, and with stating like the purpose and the action, the purpose and the action of the medication. I will do my hand hygiene, and the first one I will be given the TB test. And with the TB test, I will check the skin to make sure there's no lesions or bruises or anything. I will get me a pair of gloves on. With a pair of gloves on, I will, for the TB test, is 5 to 15 degree angle with the TB test. Okay. I will take my alcohol pad. I will prepare the skin, clean it from the inside out, firmly clean from the inside out, never touching the same area twice. I will let it air dry, and then I will pull my TV skin, test, and pull my TV skin test out, prepare my needle, because my dosage is already prepared. And then I will insert the needle, because it can be inserted at a 15 to 5 degree angle. So I am going to insert it with a 5 degree angle with the bevel end up, pushing it in. Well, if I can get it in. Ain't going. With the bevel end up. There we go. It's going in now. Just barely underneath the skin, like 1/8 of an inch underneath the skin. Just where it shows the bevel end of the needle in. And I will inject the medication in slowly. The TB medication. Which, by the way, the TB medication, and watch for the wheel. TB medication is tuberculin. And watch for the wheel to appear. And then pull the needle out the same way. I put it in. I will take the needle and let's say I push the gauge up on it. And then I will drop it in my sharps container. I will remove these gloves. If there's any blood or anything, I will dot it with a cotton ball. Take these gloves off, remove them, do a hand hygiene because I'm going to do changing gloves within, in between each one of the shots, because just to prevent contamination. Okay, with the subcutaneous. It's subcutaneous. It is an insulin shot. The insulin shot, I checked the glucose. The glucose was 300. And the order says for 10 units. I've checked it, double checked it with a nurse and everything. Everything's fine. I looked it up in the drug book, and based on administration and his weight and everything. And I'll explain the insulin Lantus is to help control your sugar, and it's given how do I say that? It helps control your sugar, and it gives subcutaneous injection. And I'm giving it in the outer, out on the abdomen, from 2 fingers out from the belly button. I'm giving it on the abdomen. And I'm giving it at a 90 degree angle. And I did my hand hygiene. I will put my gloves on. And I will take my alcohol pad. I will firmly clean the area from inside out, never touching the spot twice. It's given in the abdomen. And then I will get my insulin needle. And I will give the 10 units of insulin. Pull the cap. Dominant hand, non-dominant hand. Pull the cap off. Maybe. And then I will pull the skin taut. I will inject the needle into the skin, pushing down the plunger slowly, injecting it. I think it's like 10 seconds per milliliter. And I will pull it out the same angle, 90-degree angle. And then I will gauge my safety and then dispose of it in the sharps container. And if there's any blood, I will dab the site, come back and check like within 2 to 4 hours to see if there's any displacement or any bruising or anything on the skin. I will take my gloves off and dispose of them. Dispose of the alcohol and everything. Do my hand hygiene again. And then I have one more injection. The intramuscular injection. I'll spit it out there sooner or later. And with the intramuscular injection, it is done at a 90-degree angle. It is for a flu vaccine. Okay? And the flu vaccine is Flozone. Flozone at 0.5 milliliters. And I will go explain the flu vaccine that is given to protect against infection and illness. Okay, and then I will put my gloves on. Well, I'll do my hand hygiene again. Never could do it too much. Do my hand hygiene. Put my gloves on because I'm changing gloves in between each injection. Sorry if I'm fumbling around on the videos because I'm trying to remember everything for one whole video. Okay, I got my gloves on. So I explained everything to him. What the flu vaccine was for is for infection and illness. So I'm going to clean the skin from the inside out. And when I give the injection, I'm giving it to him in the deltoid. So I will do 3 fingers down from the chromium process, do my V shape, and, well, however, my V shape, and do my shot within the imaginary V shape in the middle, and the thick part of the muscle in the middle of the V. So I will do the cleaning from the inside out, never touching the same areas twice. And I would pull the skin taut when I do the injection. I will pull my needle out, pull the skin taut, inject straight in 90 degrees, bevel end up, and inject in the site. Which it should have went all the way in, but it didn't. Because of this thing here. Pull it back out, 90 degrees. I will gauge my safety. And then dispose of it in the sharps container like it's supposed to be. I will, now with, how do I do it? With some injections, okay? With some injections requires you to hold the site for 10 seconds or longer. It allows the medication to diffuse itself. But with this injection, with the flu vaccine, I didn't have to do that. Now, when you're giving injections, it is based on, like, let's say you got a skinny grandma. With a skinny grandma, with a subcutaneous, you will give it to her kind of like in a 45-degree angle. Let me show you. Okay. The intradermal is, and the subcutaneous, and the intramuscular is given in 90-degree angle. Okay. Subcutaneous is either given in a 90-degree angle or a 45-degree angle. And with the intradermal, an intradermal is like the TB test and the allergy testing. And with that, you give it in kind of like a 15-degree angle or a 5-degree angle, just barely going underneath the skin. I wanted to make sure that I explain that. And then after I got everything done, I take my gloves off, I do my hand hygiene again, and I go document the injection site, the date, the time, the effect of it. The effect of it and any side effects that is showing when I go back, after the allotted time or the appropriate time or whatever. And I hope you guys liked the video. Sorry that I fumbled around with it, but I'm nervous. I've done this 100 times, and I just keep trying. I hope you guys like it, and I hope that I did good on it. Thank you.